Namaste and welcome to the concluding session of Living Ayurveda. As we discussed, Ayurveda means the knowledge of life or longevity, and it is a holistic science and art of living and healing, which encompasses the various facets of life. It looks at various causes leading to disease, and therefore it has different treatment modalities to deal with the different causes. So let us look at the various treatment modalities that Ayurveda uses to heal or cure disease. Here you see the picture of a physician who is called a Vaidya, an Ayurvedic physician, the Vaidya taking the pulse of the patient. And this pulse reading, which is called Pariksha, not only gives an idea of the imbalance of Vata, Pitta, and Kapha in the body, but the Vaidya can also get an insight into the past deeds performed in the previous lifetime, which have led to karmic illness. So, Vaidya is not a simple doctor, but he is that Ayurvedic physician who has the ability to know, to read the mind of the patient, and also to change the mind of the patient. So, that was the ability of the Vaidyas. And so, therefore, Ayurveda, since it looks at the different causes of disease, it has different treatment modalities. So, there are three kinds of treatment modalities according to Charak Samhita, which is the classical textbook of Ayurveda. Trividham Oshadham iti, Deva Vipashrayam, Yukti Vipashrayam, Sattva Jayascha. That is, the three treatment modalities are Daiva Vipashray, divine or spiritual therapy, Yukti Vipashray, that is therapy based on reasoning, and Sattva Vajay or psychotherapy. Daiva Vipashray is the first treatment modality, which is divine or spiritual therapy. Daiva means divine or celestial, and Vipashray means depending on or taking refuge in. So the treatment modality that uses or depends on divine or celestial power is Daiva Vipashray. Now, disease can be classified into dosha vyadhi and karmaj vyadhi. Vyadhi is disease, so it could be either because of an imbalance of doshas, because of dietary factors, because of faulty lifestyle or disturbance in the mind, and it could be due to deeds performed in the previous lifetime. So, this is karmaj vyadhi, the diseases which are caused by our past actions are karmaj vyadhi. So this category of disease is treated by Daiva Vipashray, since it is due to the impressions of our previous lifetimes. So the physical body disintegrates after death, but the impressions of our karmas or deeds are carried on in the subtle body into the next life. And because of that, we experience many diseases. And Daiva Vipashray treats these diseases. Ayurveda pinpoints the cause of disease in all conditions, whereas in modern medicine, many diseases are labeled as idiopathic, which means that the cause is not known. Often, the clinical features or the causative factors cannot explain the disease. That is, we do not have enough evidence of cause of the disease. But in such circumstances, Ayurveda describes it due to the karma which is performed in the previous life. And many autoimmune conditions and cancers fall in this category. And so this treatment is beyond reasoning, and it requires a certain degree of faith. Whereas the dosha vyadhi is those diseases which are caused due to an imbalance of the doshas. And here we use rational therapy, which is yukti vipashray. So if there is an increase in vata, we will prescribe a diet or a lifestyle or herbs which will reduce the vata, and so on. So there's no faith involved. It is simple balancing of the doshas by rational means. Now there's a third category which could be a combination of both, that is, dosha karmaj vyadhi, which involves both an imbalance of the doshas and karma, which is being carried on from the previous lifetime. So, in such diseases, we need both modalities of treatment, but it is often seen that unless the karmaj vyadhi element is treated by Deva Vipashray, Yukti Vipashray will not have any effect in controlling the imbalance of the doshas. So, that is the importance of the role of Deva Vipashray. Now, what are the modalities used in Deva Vipashray? So the first one is mantra, then we have Oshadhi, that is herbs, money, gemstones, mangal, that is amulets or sacred threads which are tied for protection, bali, that is offering to God, upahar, offering gifts or charity, homa, that is fire ceremony, niyam, that is observance of scriptural rules, Prayashchit, atonement. So when one confesses one's deeds and has repentance for them and performs penance to undo the effect of those misdeeds, that is Prayashchit, and that is a form of healing. Then there is Upavas, that is fasting, Swastyayan, that is chanting of auspicious hymns, Pranipat, prostration or surrender, and Gaman, pilgrimage. So these are the modalities of treatment under Daiva Vipashray, that is using divine energy or the celestial forces to treat disease. Mantra is basically a sound which is imbued with divine energy. Mananat trayate iti mantraha. That is, mantra is that which protects by the one who repeats it constantly is protected by that repetition. So the different mantras that are used, they could be bija mantras, that is seed mantras, which use a single letter of the alphabet. There are mantras which have many words set to a particular meter, which is called a chanda. There are different mantras used for different conditions. In fact, Ayurveda uses mantras for harvesting the herbs. There are mantras which are used while administering the medicine before performing panchakarma. Om is the primordial sound and it is a very potent sound, and many people are aware of the advantages of this. The Gayatri mantra is also a very popular mantra. So these have been shown even by modern research to have a profound beneficial effect on cognitive function and also on healing of physical diseases. Ayurveda uses many mantras for different conditions. There are mantras which are used for mental illnesses, usually along with a fire ceremony, because most mental illnesses, especially the severe ones like schizophrenia, have a base in the karmic illness. And then there are mantras which are used to nullify the effect of the poison of snakes. And someone sitting miles away, uh, someone who knows the mantra can chant the mantra and nullify the effect of the snake bite of the patient who is sitting very far away. But this requires a certain degree of sattva or purity by the person who is chanting the mantra. And so, mantra is actually one of the most important ways in which the impressions of the previous lifetime can be washed away. Then there is Oshadhi or herbs. Herbs definitely have physical properties which are healing and they create a balance of Vat, Pitta, and Kapha. But in addition to that, there are many herbs which have divine power or work on an energy level, and this is called a prabhav, the effect which is beyond the taste or the potency of the herb, which cannot be described just by the physical effect of the herb. Many of you would have seen this picture of Lord Hanuman carrying the mountain, and the story goes that during the fight um, between Ram and Ravan, Lakshman was injured very severely and he was nearly on his deathbed. And when the Vaidya, that is the doctor, the Ayurvedic physician prescribed a herb which is called Sanjeevani, that which can conquer death. And so this was found on the mountains, and Hanuman was requested to go and collect the herb. When he reached the mountain, he could not identify the herb, and so he picked up the entire mountain and carried it. So that is the effect of the or the potency of these magical or divine herbs. There's tulsi, which has a potent respiratory benefit. In addition to that, it also has a potent energy which can help nullify the effect of um a wrongly or a faulty position of Mercury in the astrological chart. Also, it can correct defects in the Vastu, which is the architectural layout or planning of the building. And it is used in prasad, that is, whenever an offering of food is made in front of God, tulsi is always offered because of its potent energy. Similarly, there's apamarg, which is another herb which is very easily found as a weed and which is called prickly chaff. You have these little seeds that stick on to the clothes as you walk through the bushes, and this has a potent effect on the uterine contractions. So, if the root of this herb is just placed on the abdomen of the lady who is in labor, it actually facilitates painless labor and will augment the labor, and it should be removed from the abdomen after the baby has been delivered. Then there is Sahadevi, which is also found commonly as a weed, and it has a potent effect on sleep. And we've tried this in patients, just placing the root of this plant on the forehead of the patient when he goes to bed can induce sleep in patients who have difficulty falling asleep. So, this is the divine power of these herbs, and they work on an energetic level. Then there is money or gemstones. So, different stones are used to treat different diseases. Now, these precious stones, they cause a change in the energy. They harness the cosmic energy and they cause a change or rebalance the energy of the person who wears these gemstones. So, different stones are linked to different planets and they have different effects. So, the ruby, it represents the sun and it has a warming and pungent effect. So, because of this warming and pungent effect, it balances Vat and Kapha but can increase Pith. So, it's good for the heart, circulation, memory, and enhances self confidence. Similarly, pearl represents the moon, and so it has a cooling and nourishing nature, and it pacifies Pith and Vat and can increase Kapha. And because of this calming and nourishing effect, it calms the nervous system and increases bodily fluids. So it's a good general strengthener for women and infants. Emerald also has a slightly cool energy and increases kapha. It calms Vat and Pith, and it relates to the planet Mercury. It improves speech, intelligence, and ease of communication. Then there's diamond, which is a very powerful stone. It builds ojas. It's tridoshik. It pacifies all the three doshas and strengthens shukra, which is the sexual fluid, and slows aging and brings prosperity. So probably that's the reason people have give or exchange diamond rings when they get engaged. So because it strengthens shukra, builds ojas, brings prosperity. Then there's the blue sapphire, which is a heating stone, and it pacifies Vat and Kapha and can increase Pitta because of its heating action. It promotes calm and peace because it pacifies Vat, and so it strengthens nerves, bones, joints, and muscles. And we know of many people who've had problems in the vertebral column or in the joints or nervous disorders who, after wearing the blue sapphire, actually experience a lot of relief of their symptoms. Then there's coral, which is a red stone. It represents Mars and it has a sweet and cooling effect. So it reduces kapha and pitta and it's neutral for Vat, so it's kind of tridoshik. and it improves color complexion and imparts gracefulness. Interestingly, medical astrology is linked to Ayurveda, and coral bhasma, that is a preparation from the coral which is used internally, is used in Ayurveda to treat many diseases of the liver and blood. And so it has a cooling and sweet effect. So these stones, some preparations are used internally, but here we are talking about just wearing the stone externally on the body. So the stone should be in contact with the skin. So if it is set in a ring, it should be set in such a way that the stone is in contact with the skin, and also the stone should be of a certain carat, a certain weight for it to be effective, and one must make sure that the surface does not have any cracks. So the stone should be of a good quality, and most importantly, that we must not start prescribing stones for ourselves, because this is actually a very, very complex science and requires the knowledge of an expert. So there are experts in medical astrology who can prescribe the right kind of stone. And again, this requires a lot of sadhana to actually know and be able to provide the right remedy. Then there is Homa, which is the fire ceremony. So usually the different offerings that are made to the fire, and this is a ritual which is done along with chanting of various uh, hymns in Sanskrit, different mantras, and so it is combining the effect of the mantra of sound energy and the offering, which is changed into a subtle form by the fire, and this is the offering made to different deities. Um, to get different desired effects. So the various offerings that are made are wood, and wood of specific trees is used, not any wood. So there are different specified woods that are prescribed. Then there is ghee, and we've already talked about the special quality of ghee. Then there is rice, there is barley, there are dried cow dung is used, and this also has a profound effect. And there has been a lot of modern research to show how this can purify the environment, both on the physical level and on the energetic level. So, Homa or fire ceremony actually brings rain. So, the scriptures say that it attracts rain, and rain is important for agriculture, and our life depends on agriculture. So, it's important for the sustenance of life on the planet. And different homas have been prescribed for different diseases. There are homas that are prescribed for mental illnesses. There are homas which is prescribed for infertility. Interestingly, we had such a homa or a fire ceremony in our ashram here a few years ago, and there were 5 couples who had infertility, and they sat for this yagna. And as a doctor, one is sometimes skeptical about such things. And since most of these couples had a very long history, and most had been together for over a decade and had been infertile, and in fact, one of them had very atrophic ovaries, that is, the ovaries were very small and atrophied, the size of a menopausal woman. So I was a bit skeptical about how the yagna would really work. But I was amazed to see that all 5 couples conceived, and the children, most of them are about 8 to 10 years old now. So this is about Homa. And again, here it involves faith. As with any other modality in Daiva Vipashray, it is dependent on the faith of the person, and also the power or the of purity. So that is the sattva of the person performing the ceremony. There was another boy who repeated a mantra, and he cured his keloid with that. So that was another very amazing experience for me, because a keloid is a big, thick scar that is formed as a result of an injury, and he had this thick keloid on his wrist, which was secondary to an injury that he had had in the past. I tried all kinds of ointments and It was a very resistant keloid, is very thick in the skin, and I tried it for about 2 months. Nothing worked, but he came to me just 2 days after I had examined him, and the keloid was absolutely gone. The skin was clear, and I thought, I mean, this is not possible. I asked him, how come it's vanished? He said, I repeated a mantra. So he was a little child, about 11, 12-year old. So because of the purity of his heart, he was repeating this mantra which someone had given him, and I had told him that that would heal his condition. And because he repeated it with such faith, that it actually worked in 2 days, it is not possible to explain it on any reasoning. So these procedures or these practices have profound effect if there is faith. Then there is upavas, that is fasting, and fasting, there are many medical benefits of fasting. In fact, the Nobel Prize for Medicine in the year 2016 was given to a Japanese scientist who worked on fasting. So he did a study on autophagy, that is the consumption of the old degenerated cells by the body, and the effect of fasting there is on this autophagy, and how fasting actually promotes autophagy and will delay aging. So upavas actually means upa and vasa. That is, upa means near and vasa means to dwell or to stay. So to stay near or dwell near. So near what? It is near the divinity which is within us. So not only does fasting reduce the load on the digestive fire and clear arm and detoxify the physical body, but also it clears the mental clutter. And so when we stop eating and focus on the silence, on the divinity within, it creates both a physical benefit and also it nourishes the soul. So that is upavas. Then, so this was Daiva Vipashraya in brief. We come on to the second modality, which is Yukti Vipashraya. Now, Yukti means rational strategy, and Vipashraya means depending on or taking refuge in. So, Yukti Vipashraya is basically rational therapy. So, understanding the causes of the disease and then designing the remedial measures according to the cause. So, if there is an increase in Vata, we prescribe a diet that will reduce Vata. Similarly, a lifestyle which will pacify Vata. So, it involves diet, herbs, lifestyle, and panchakarma. So, all that we've discussed so far in all the previous sessions comes under Yukti Vipashraya, that is, rational method of treating diseases. And we already discussed in the definition of health, that is, samadosha samagnischa samadhatu malakriyaha prasannatmindriya manaha swasthya itya vidiyate. So Shrut Samhita says, defining health. So who is a healthy person? One who is in perfect health. One is in perfect health when the doshas, that is Vata, Pitta and Kapha, the fire, the body tissues, and the excretory functions are in perfect order, with a pleasantly disposed and contented mind, senses, and spirit. So that is the importance of the mind. The mind is imperative to the state of health. So without a peaceful mind, one cannot be healthy. The Ashtanga Hridaya, which is another textbook of Ayurveda, says, Nityam hit ahara vihara sevi samikshakari visheshva saktaha data samaha satyaparaha shamavan apatopasevi cha bhavatya rogaha. That is, a person who regularly follows a beneficial diet and lifestyle, is deliberate in all his actions, does not overindulge in sense pleasures, is generous, just, truthful, forgiving, serves his elders and teachers, is unaffected by disease. So again, here it talks about the importance of the mind and all these mental virtues. So generosity, justice, truthfulness, forgiveness, service. All these are important for both mental and physical health. We see now that the statistics tell us that 1 in every 5 persons has depression. The degree varies, the severity or intensity varies, but this is an alarming figure. And a study showed that about 42% of corporate employees had some degree of depression. 450 million people suffer from a mental or behavioral disorder, and nearly 1 million people commit suicide every year. And these are the alarming statistics from the WHO, the World Health Organization. So, definitely, uh, regarding the mental health, there's a lot that needs to be done. So even if the mental health does not go to such a degree of imbalance, there is a lot of stress in each one's life. And we see that stress related diseases like diabetes, high blood pressure, coronary artery disease, obesity, autoimmune disease. Now, autoimmune disease also has a very close link to stress, and research has proved that stress is an important factor leading to autoimmune conditions. Poor immunity, allergies, cancer, and the list is endless. So, all these conditions are on the increase and they're all attributable to stress. So, definitely, the mind is something which is very important. Now, here this graph shows the level of stress on the y axis and how it affects the performance on the y axis. So, on the x axis, you have the level of stress. So, as the level of stress builds up, one shifts from boredom to excitement to getting energized. So, say for example, a student has to appear for an examination. So, that is a stress. So, stress is basically any external factor which draws us out of our comfort zone. So, that is stress. So, the student will go from boredom to excitement to getting energized and to getting focused on his work. So, actually, till here, we see that stress is actually good or useful or beneficial. So, this is the optimal performance of the person, that is the peak here. And if the stress increases beyond this point, it is no longer beneficial, but it becomes detrimental. So the person feels challenged, and then fatigue sets in, the person gets exhausted, and finally ends up in a burnout. So initially, when there is no stress, the person is calm, and then there is a degree of stress which is actually beneficial and productive, which improves our performance, which is called the eustress. And then when it becomes detrimental and counterproductive, it is called distress. So, what happens when there is um, weakness in the mind, when the mind is weak? This is what happens. So, a small amount of stress leads to a very, very small peak. That is, the performance is not so optimal, very poor performance, and soon there is a decline in the performance leading to distress. So, this is beginning of stress, and so this is eustress, and soon there is distress. That is, a very small amount of stress is ending up in distress very soon. So most of us are in a state of sympathetic overactivity most of the time. So we'll talk about the fight flight response. When we're exposed to stress of any kind, we go into the fight flight mode. Now, what is this? This is a natural mechanism, a natural physiological mechanism that is inbuilt in the body. So, when in the Stone Age, when man stayed in the jungles, uh, what was the stress? The stress was a wild animal, like a boar or a lion, and there were two responses to that stress: either fight if the animal was small and one could fight the animal, or the other response would be flight, run away if the animal was too big to fight. So, to either fight or to run away, we require different regulatory mechanisms come into play. So changes happen in the body. That is, we have two divisions of the nerves. We have the sympathetic nervous system and we have the parasympathetic nervous system. So during a fight flight response, the sympathetic nervous system gets activated. During that response, we need more blood flow in the brain to be able to think, to decide how to fight, where to run. We need more blood flow in the muscles to fight or to run away. And the pupil needs to dilate so that we can see. Uh, and at the same time, the salivary secretion and, in fact, the secretion of all the glands reduces. So, and there is an increase in the heart rate, there's an increase in the blood pressure to provide the extra requirement to the brain and to the muscles. So the heart beats at a faster pace, the blood pressure increases so that there is extra delivery of blood with the nutrients and oxygen to the muscles and to the brain, which is important at that time for the fight and flight response. And also, there's a dilatation of the bronchi, that is, the air passages will dilate so that more oxygen can go in. And there's also an increase in the blood glucose level because of the increase in requirement of glucose by the active muscles and brain. So the liver will convert glycogen stores into glucose, and so the blood glucose will increase to meet this demand. And there is an inhibition of the motility of the stomach and the intestines. So the peristalsis, or the movement of the gut, is inhibited, and the sphincters will contract because elimination or excretion is not important at that time. And also there is a reduction in blood flow to the intestines and to the kidneys because the blood is redistributed through the body, and more goes to the brain, more goes to the muscles, and less goes to the gut and to the kidneys. So, and the opposite of this is the parasympathetic nervous system, which does just the opposite. So there is constriction of the pupil. This stimulates the tear glands, stimulates the salivary glands, stimulates the gastric juices, inhibits the heart. So there's a reduction in the heart rate and reduction in the blood pressure and so on. So this happens when we are in the rest and restore phase. That is, when there is no stress, we are in the rest and digest or rest and restore mode. But when we are in the stress mode, the sympathetic division, that is the fight flight response, is active. So this is the physiological impact. This graph shows the impact of the acute stress on blood glucose levels. So blood glucose levels normally that are maintained, say here, 5.5 millimoles as average blood glucose. And here, when faced by an acute stress, you see that there's a sudden peak in blood glucose and it can go really high. And then as the stress, so the stress lasts only for, say here, 20 minutes, 1920 to 1940. And after the stress goes, the level goes on increasing for some time, and then there is a slow decline and it comes to baseline. So basically, after we fought the stress, so after we fled from the place or we fought the animal, the graph will come back to normal. Similarly, for blood pressure, the heart rate, the breath rate, everything, the graph will come back to normal. But what happens in today's age? We're not staying in the jungle. So the stress is not the wild animal, but it could be our spouse, it could be our partner, it could be the boss, it could be the teacher for a student, it could be a financial situation, it could be a disease, a health condition, and so on. So these stressful events cause the same physiological responses. That is, there is an increase in heart rate, there's an increase in blood pressure, increase in blood glucose, there's contraction of the muscles, and so on. But these metabolites are not used. Um, most often at least, we don't end up in a physical fight with our partner or the boss, or we don't run away from the place of work, or we don't run away from home. So this extra blood glucose is not getting utilized. So the graph takes a long time to return to the baseline. And after we've faced one stressful event, say in the morning, you have an argument at home, you go to your place of work, and then you have another conflict at the place of work. So, and then coming back, you're in a traffic jam, there's road rage, and so on. So, one stressful event after the other. So, one peak here, and then the second peak, and then the third peak. So, it hardly comes back to the baseline. And slowly, the entire graph, the baseline shifts up. And so, if the baseline of the blood glucose graph shifts up, you get what is called diabetes. So similarly, if the baseline of the blood pressure graph shifts up, you get high blood pressure, and so on. And if the blood flow to the gut is continuously or repeatedly compromised with each stressful event, there is poor blood flow to the gut, which leads to poor functioning of the gut, a decrease in the gastric and intestinal juice secretion, and a reduction in intestinal motility, leading to irritable bowel disease, leading to constipation, leading to a suppression of the Agni or the digestive fire, and creation of more Am. So you see how stress can lead to a dampening of the Agni and create more Am toxins in the body. And we know that if there are more toxins, there's more Am, it can cause all kinds of diseases from fever to allergy to cancer to autoimmune conditions, everything. So this is how stress impacts our bodies and can lead to disease. So we come to the third treatment modality, that is Sattva Vajay. So Sattva and Avajay. So Sattva refers to the mind, and Avajay means to conquer or win over. So Sattva Vajay means conquering the mind. Now, why is it important to conquer the mind? Because the mind is can be our best friend or it can be the worst enemy. This is what the Bhagavad Gita says. And in fact, the mind is a very wonderful servant, but it is a terrible master. And therefore, we must know how to conquer the mind. So we have to build resilience. And the analogy that I'd like to use here is the difference between a glass window and a brick wall. So if one throws a stone on a glass window, it breaks. Whereas if the same stone is hit on a brick wall, it is not affected. And so if I ask you what is the cause of breaking of the glass, most of you would say it is the stone. But if the stone was the cause, then the brick wall should also be damaged. Since the brick wall is unaffected and the glass breaks, we can infer that the cause of damage is not so much the stone, but the lack of resilience, or it is the weakness in the glass. So by Sattva Vajay, by building strength or resilience, we are overcoming the effects of emotional disturbance that we've just looked at. So this is achieved by increasing Sattva or purity to subdue the exaggerated Rajas and Tamas. So there are three gunas that have been described: Sattva, Rajas and Tamas. So we increase Sattva to subdue the effect of the exaggerated Rajas and Tamas. Most people are in a state of excessive Rajas or Tamas. So as one builds Sattva, the mind is conquered, and that is Sattva Vajay. So Sattva Vajay is basically to repeatedly withdraw the mind from detrimental objects. So the mind has a tendency to be pulled by the different senses and to have a control, and this requires constant practice. And this Sattva Vajay builds Dhi, Dhriti, and Smriti. So, Dhi is intelligence, Dhriti is fortitude, and Smriti is memory. And usually, when we lack either or all of these, it leads to taking wrong decisions, performing wrong deeds, which will cause not only mental problems but also will lead to physical illness. So, Sattva Vajay, or strengthening the mind, conquering the mind, will prevent and correct impairments of Dhi, Thriti, and Smriti, that is, intelligence, fortitude, and memory. So, this not only benefits mental disorders but also the physical diseases, the psychosomatic conditions that we just talked about. So, all the diseases that can happen because of the imbalance in the parameters in the body that happens as a response to stress. Now, this is easier said than done. Having said this, it is not impossible. It is difficult, it requires effort, but it is not impossible. In fact, this is the only way to be, to put in that effort. The Bhagavad Gita says, Arjuna says to Krishna, Chanchalam hi mana Krishna, pramathi balavad dridam, tasyaham nigraham manye, vayo rivasa dushkaram. That is, O Krishna, the mind is so fickle. It's like trying to control the wind. How can you control the wind? How can you hold it? So, Lord Krishna says, Asanchayam Mahabahu, Manu Durnigraham Chalam, Abhyasena tu Kaunteya Vairagyena Chagriyate. That is, there is no doubt, O Mahabahu, O brave one, there is no doubt that the mind is fickle. Now, here Krishna is addressing Arjuna as the brave one. And we also have to become brave like Arjuna, have to control the mind, because that is the only way. And he gives the key to this. He says, Abhyas and Vairagya, that is, practice and detachment. These are the two keys to control the mind. And therefore, constant practice is very important. And detachment, because we have to understand that the fluctuations of the mind, the desires of the mind, the duality in the mind, the attachment and the aversion, all this is very ephemeral. It changes by the minute. One day we will say, I love you, and the next day we say, I hate you. So this is how the mind plays its games. And therefore, we need to conquer the mind. I'd like to share a story which beautifully describes how the mind can change our perception. The scriptures say that Ya Drishti Sa Srishti. That is, we see the world as the perception of the world depends on our vision. So the story goes that there is a couple who have a son who's about 4 years old, and this 4-year-old son is very dear to them. So that's that's the point. Their life revolves around the son, and he gets lost. So they're devastated, and they spend their entire life crying and remembering their son. About 20 years pass, and not one single day have they been peaceful or happy. They've spent each day crying, remembering their son, and being miserable. Someone comes 20 years later and tells them that their son is alive and he's in a village far away, and he gives them the address of the son, the whereabouts of the son, and the couple is overjoyed and they want to go and see him. And this is the story of olden times where the means of transport were limited. So the husband tells the wife that he will go and get the son back. So he sets out on his travel and he carries in a bundle whatever money he has. He walks on foot, he goes by the bullock cart, and it takes him about 20 days to reach the outskirts of the village where his son is supposed to be. So it is already dark at night, and he plans to spend the night in an inn and start again next day early morning to go meet his son. So as he retires for the night, a lady who's in the adjacent room comes and knocks on the door and says, "Sir, can you please help me? Because my husband is very unwell and he has cholera, he's having vomiting and diarrhea. And can you help me take him to the doctor?" And this is the rural setting about 100 years ago, and where medical help was not very easily um, get where we didn't get medical help so easily, and so the doctor is far away, and the lady asks for help. Now this man thinks, I just have very little money left with me, which I need to travel tomorrow, and plus I need to conserve my energy. I need to get good sleep so that I can travel tomorrow. So he says, "I'm sorry, I can't help you. Please ask someone else for help." So the lady goes away, and then she comes back after an hour and again knocks and says, "Sir, please, there's no one else who can help me. Can you please help me?" Now, this man gets annoyed and he says, "I'm sorry, don't disturb me again." And he just shuts his ears and he puts cotton, he plugs cotton in his ears, and he just goes to sleep and thinks, "Oh, what a bad omen. Here I'm going to meet my son, and this lady is coming again and again to disturb me." Then early in the morning, around dawn, he hears the lady crying, and there's a mob that has gathered. He opens the door and he finds out that the man, the lady's husband, has passed away. He died because of dehydration. uh, and he thinks, "Oh, this is terrible, but you know, I'm going to see my son, and here I'm having to see a dead body before going. So again, this is a bad omen." And he's cursing the lady and cursing the man. And just then, the man who actually gave him the address of his son comes, and he says, he tells him, "Where are you going?" So he says, "Oh, I'm going to meet my son. I've traveled 20 days and I'm going to see my son soon in like a couple hours." So the man tells him that this man who's dead is your son. You can imagine how shattered the person is. And so the same person who was a source of nuisance, of trouble to him just a minute ago, now is perceived in a totally different light. Now he sees him as his son, and he's full of repentance, of remorse, because so here is the mind. So it is, if the mind thought of this person, if there was aversion or there is attachment. So this is the game the mind plays. So if there's attachment, the object is perceived as good, as lovable, likable. And if there's aversion, the same object is perceived as a source of pain or suffering. So this is how yoga or an Ayurveda talk about strengthening, that is conquering the mind, because the mind is the source of pain and pleasure and not the external object or situation or person. So who's driving your chariot? The scriptures talk about this chariot, which is actually the human body. The master of this body is the consciousness or the Atman who rides this chariot. And it's driven by the senses, that is, the sense organs. These are the horses which actually pull this chariot. And the reins that hold, that are controlled, that control is the mind. And it is controlled by the buddhi or the intellect. So what is easy? It is easy to let loose the reins and you get pulled by the horses in whatever direction they are attracted towards. But what is wise? Wise is to keep the reins pulled tightly so that you can control the horses, and the horses don't pull you in the direction they want to, but you can steer them in the direction you want to go in. So that is the importance of being in control of the mind, and that control is gained by the buddhi. But when we activate or build our intellect, when we can differentiate between what is good and what is not, what is favorable or beneficial for us, and what is not beneficial or what is harmful, rather than what appears or seems pleasant or adverse, but what actually is beneficial and harmful. So when we use this um, discernment, which is the function of the buddhi, we can control the mind. So there are other techniques which, other than contemplation, like meditation, which are also used to strengthen this control. And meditation, there's been a lot of research, and I'm sure you would discuss this in the yoga course. Just a few points: it increases the parasympathetic tone, so there's better sugar and blood pressure control, there's better digestion, there's less harm, so it reduces inflammation. And this is supported by a lot of research which has shown that different molecules like the CRP, the C reactive protein, produce when you do meditation. It improves immunity, which is shown by an increase in the CD4 T cell count, and so on. So we use all these techniques to strengthen the mind, to basically connect with that divinity, the self within, and not be driven by the mind and the senses. This shows the brainwave synchronization as a result of meditation. So here there's unbalanced brain wave patterns in the normal state. And after 15 minutes of meditation, you see that there is synchronization. And after 25 minutes, this is even better. So it leads to an improvement of both physical and mental health. And of course, techniques like Yoga Nidra, which can actually have an effect deep down to the subtle body and help remove the karmic impressions on the subtle body, and thereby help us gain a control over our mind. So we conclude with the prayer Om Purnamadaha Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnamevavashishyate. Om Shanti Shanti Shanti. This prayer says that is perfect, this is perfect. From the perfect comes the perfect, and verily the perfect remains. Om, may peace prevail. So I hope you enjoyed all the sessions and can benefit from this knowledge, and may our lives be inclined more and more towards that perfect which dwells within each one of us. Namaste.